Hi, everyone. Happy end of the 4th of July weekend. I hope it was as great a weekend for you as it was for me. We had great occasions together, family and community, really our biggest community events since the beginning of the pandemic. And it's wonderful seeing people and being able to smile and laugh and have parties together and all of that. So I hope your weekend was just as nice. A couple things happened in the industry over the weekend. Number one, fireworks and people wanting to light them off that are not professionals is still a really bad idea. We had fires locally. We had structure fires based on fireworks. We had, some wildland fires initiated by fireworks, etc. As dry as it's getting across the country, boy, we got to be careful. My look forward is I still have a hope that Labor Day weekend is going to be our celebration of the end of the worst part of COVID, and that people will really be in the mood to celebrate. And the fireworks may come back because fireworks sales were incredible for this past weekend. If so, and of course, September can be a really dry time, even worse so than now. We're going to have to be on the top of our prevention game come Labor Day weekend, if in fact we are going to be celebrating. So be careful of that. The other, event of the weekend was the terrible active shooter off the rooftop in Highland Park, Illinois. We are going to have to be changing our plans around these soft events. We had a huge parade in our community. We did not think about launching drones to do overhead surveillance, neither us nor law enforcement, but I have a feeling that that's in our future, that kind of surveillance will be necessary above events like parades. And then, how do you begin to activate the program when people are just fleeing in every direction? So important training elements from the weekend. All right, COVID news. End of 4th of July. We are going to look forward and we're going to look back this week. So here's the really important news of the week related to coronavirus. A very good study was done that looked at the death impact in the United States from March 2020 through October of 2021. So a big, long period, 18 months, where we went through several of the big waves. And the really horrible news is that during that time period, about the third leading cause of death in the United States was COVID. We had a lot more cancer deaths and more cardiovascular deaths during that same period because of the interruption of the healthcare system. But we had a significant number of COVID deaths. So for anybody who says COVID isn't real, COVID is not that dangerous, et cetera, it clearly demonstrated itself over 18 critical months that we had a huge death impact. That impact was ameliorated beginning in December of 2020 when we began the vaccination programs that many of you have been a part of. And the estimates of how many lives that saved and how many cases of the disease that saved, when you multiply out what we did with our vaccination program, we saved at least 1 million lives, And so we are benefiting still from the vaccination program that took place starting in December 2020. Most of it, though, contained in 2021. That was our big time of getting people vaccinated. Into 2022, it is our opportunity to continue to think through the vaccines. So that's why we're going to talk into the future here. So in the past, COVID, big death impact, third leading cause of death from March 2020 until October of 2021, but a huge impact of vaccinations in reducing hospitalizations and deaths during that same period of time. And hopefully that moves us into the future. Right now, BA.5 is the predominant Omicron subvariant that is circulating in the United States. It very quickly moved up. It is more infectious than the other Omicron subvariants. It is continuing to cause relatively more mild symptoms. It's bursting into programs in the fire and EMS service. Many of our events, people go home. They got a number of people who picked up the virus at the event. Very fortunately, in the services around me, no hospitalizations, no deaths, no long COVID cases at this point. That's really good news. So we have a very infectious subvariant right now, BA.5, moving quickly through people in the community, including people who have been vaccinated, including people who have been ill before. So don't let that surprise you. We still are at the 5 to 10 day isolation programs. And some scientists believe we should routinely be doing 10 days. But at the present time, the CDC recommendation is still 5 days independent isolation, 5 days with a mask if you're going back to work. So just so everybody has that in mind. Now, the real news is, what are we planning for into the fall? It is hopeful that we will continue to see a relative decrease in the number of cases nationally, which is frankly where we are right now. Even though BA.5 is spreading, the number of cases, hospitalizations, and deaths are going down in America right now. That's why I said potentially over the next 7-8 weeks, we could be celebrating a tremendous decrease in the number of cases, hospitalizations, and deaths from COVID in this country. And at Labor Day, we might be celebrating that. Nonetheless, our scientists in the CDC and others are working ahead saying, what do we need to do in the fall to be prepared should another subvariant come in that's dangerous again? Should we begin to see the population getting hospitalized and the deaths occurring again? What do we need? The work now is in two big areas: testing and vaccination modifications. So those are two things you're going to hear about. Our ability to do testing so far has been one swab, one disease. Very much into the fall, they would like to be able to test people for multiple things without using multiple swabs. And so look forward to this fall having testing done. If you or a member of your family or another member of your department gets sick, that you'll have a swab put in your nose probably, or you may spit into something, and they're going to test for multiple things, including flu, coronavirus, and RSV, and potentially other viruses. And you'll get a relatively quick answer. And then for each of those, there's different treatment, there's different isolation, and different risk precautions for the people around you for all of those. So that's why it's important that we look at all of them. Potentially this fall, we've talked already, we might not have COVID, but it is very likely that we'll have a big flu year. And what we want to be able to do is to look for all of those diseases that may burst this fall. Number two, what are we doing in the vaccination front? Well, right now, the science is moving towards an Omicron tweak to the vaccines so that we get better coverage of the new variants that are circulating in America. With our mRNA technology, it is relatively easy to do that. As you all know, right now, they are cooking the vaccines for influenza for the fall, and that's how we do it. It takes a couple months. They have selected the influenza strains that we're going to immunize for looking to the fall. And right now they're brewing those. Starting in August, they begin to package them, and then they're available September, October. That's how we do the influenza vaccine every year. So in somewhat similar fashion, although the technology is different, they're thinking through what kind of protection is needed in the fall, who is going to benefit from getting boosters. Do we start with the elderly population again that's at risk, or the ones most at risk for the new subvariants that may be present at the time? Will people who were sick this summer be protected by one this fall, or do they wait longer? Do they wait to the winter time to get it? So those are questions we don't have answers for, but you should look for. Third thing, many of you are doing your after action reports now. I'm involved in several of those with my departments. What are we going to do it better next time? One of the feature issues really is how do we obtain and use PPE? We have learned a lot about PPE. And looking into the fall, I think we'll be back using respiratory protection, regardless of whether COVID is back or not, because I think departments will want to be protected from the other viruses as well. So influenza, RSV, adenoviruses, and other things. Our members in our departments will want to protect themselves by using N95 or similar protection in the fall. How do we access it? How do we best use it? Do we benefit still from doing eye coverings? Do we put gowns on? Is that protective, or is that just an unnecessary way for us to sweat a little bit more? So those are the things we have to look forward moving into the fall. So looking back, we've had a dangerous disease. Right now, we're at a period of time where incidence is crawling down, hospitalizations and deaths are going down. All good news. Hopefully we keep that up. Hopefully we don't see another subvariant come into play that is dangerous for our population again. Please protect yourself across the summer, but begin to think through the planning for the fall. That's going to be different than our other fall preparations for respiratory diseases that we've done in way prior years or the last 2 years in regard to COVID. So we're into July, warm weather. Enjoy a little resting time. Get some quality time in with your family. Plan ahead when you get your department meetings. What are we going to do and be prepared for this fall? And then finally, our preparation for other events around the fall is going to be around active violence issues. You can bet on it. So please take care of yourself as we go through the summer. Enjoy some good times together, and I'll see you in a couple weeks. DocTalk after the 4th of July. Take care, everyone.